Around 750 people have died because of a cholera outbreak in Malawi, with the country's health ministry describing it as the worst outbreak in 2 decades. Recent figures show that 15 daily deaths have occurred in the country. UNICEF's Malawi Deputy Country Manager, Gerrit Maritz, joins us now to talk about this situation. Gerrit, a very good evening to you. Thank you for joining us. So, how do we begin to even explain the deaths of more than 700 people from cholera in this day and age?
Thank you very much for the question, and nice to be with you and the viewers tonight. The current cholera outbreak is really unprecedented and baffles us in terms of its veracity. We saw the first case reported in March of last year, and the numbers were very low. And then uncharacteristically, we saw during the dry season the outbreak spreading to other regions. To this date, where we have all 29 of the health districts affected in the country. We were hoping to contain the outbreak of the epidemic before the rainy season started in December last year, but didn't manage to bring it to the levels we wanted it to. And now with the rainy season starting, we've seen an exponential growth in the outbreak.
And how much of a complication is that going to pose as far as arresting the spread of this outbreak?
Well, we have to make sure that we have all the strategies in place to effectively respond to a cholera epidemic of this scale. So we have to strengthen the case management at health facility level. There's a great need for medical supplies in terms of oral rehydration salts, IV fluids, and the like. We have to make sure that we contain the epidemic at the source, so unsafe water sources, water and sanitation infrastructure that's lacking needs to be improved. We have to make sure that there's a community-driven behavioral approach towards hand washing and hygiene. And then we have to make sure that we work with the leaders, the traditional authorities and the religious leaders to motivate people to report early to health facilities when they have symptoms of cholera. One of the things that we struggle with at the moment and why we're seeing such a high case fatality ratio of over 3%, which is above the under 1% threshold of WHO, is the fact that people are reporting to healthcare facilities too late. And it's then too late to start the treatment. And unfortunately, this is the situation that we are in. So lots of efforts being made to make sure that communities are aware of the signs and symptoms of cholera, and importantly also how to prevent it.
Why are people presenting at health facilities late? I mean, the health minister was saying just recently, 2 days ago in fact, that even with vaccinations, the problem they're seeing is that there were about 2.9 million doses of vaccine available. At this stage, I think about 40,000 are left, but the more high-risk people are still skeptical.
Yes, I think what we're struggling with is around myths and misconceptions on vaccination and around cholera itself. I think it's not untypical of what we saw during the COVID-19 public health interventions, where people are hesitant to take vaccines because they are told otherwise by their faith-based organizations or purely because of myths circulating in the community. So we're doing a lot of work to counter that. Why people are also reporting late, apart from religious reasons, is also because the facilities are not always very close to where the communities are. So there's a lot of travel involved, and when people wait to the last moment and then have to arrange travel to get to the health facilities, this compromises their ability to recover from cholera. So what government is doing with the support of WHO and UNICEF is to make sure that we have oral rehydration points closer to the community. So when there are suspected cases, that they can immediately start treatment and don't have to make arrangements to travel a great deal to the facilities.
Ultimately, though, it's one thing for the vaccines to arrive and every other health tip or intervention that can be introduced. But if the infrastructure challenges persist, there is still a high risk that Malawi will face another cholera outbreak. For example, when you look at water sources that are contaminated, which is where cholera then spreads so rapidly. Are the government efforts to work on the infrastructure problem, are they moving at a fast enough pace?
I think government is acutely aware of the challenges around the water and sanitation infrastructure. I think COVID was a big wake-up call to everyone that we need to invest more in water and sanitation infrastructure at community level and at facility level, whether it be healthcare facilities or schools. There's a dire need to address the shortcomings around safe access to water and water and sanitation infrastructure. Government also recently did an assessment around access to water and sanitation in schools, and the key areas or hotspot areas that need to be improved as a matter of urgency has been identified and will be addressed together with the supportive development partners. But it's not a once-off exercise. It's routine maintenance and management of water sources and water and sanitation infrastructure. So it's not just responding to a massive cholera outbreak right now. It's making sure that the systems are strengthened and that the finances and resources are in place to continue improving and maintaining the infrastructure that we have.
Gerrit Maritz from UNICEF, thank you so much for your time tonight.